You are supposed to take the history from
Mhm.
the 3 years old Milton having limp. Okay, has been referred from GP, the GP letter, who has
Mhm.
having limp. So GP has referred for further evaluation. So you have to take the history of from the father. Father's name is Albert.
Albert.
Yeah,
And child name?
John. John or
Child
Milton, what?
name. Okay.
John. Yes,
John. Okay. And the child age is 4 year,
3 year.
3 year.
Hmm.
Okay. Fine. Just give me 2 minutes.
Sorry, can you just tell us the statements again?
Yes, child has been referred for 3 years old. Child John has been referred from GP with the complaint of the limp. Has been referred for further evaluation. Limp. Child is
Okay.
having limping. Yes.
Okay, thank
But
you.
there is no duration, right? How long or limp
Yes.
since?
Since 4 to 5 days, less than 1 week.
Okay.
4 to 5 days. Yes.
Okay. Okay. Fine. Hello. Yeah. I am Dr. Hiren, one of the children doctor. I believe I am talking to Albert, the father of John.
Yes, doctor. Yes, I am one.
Thanks for coming today, Mr. Albert. Today, I am here to ask you some question regarding John's health concern. And if you don't mind, I will take some note. Is that okay with you?
Yes, doctor. Sure, you can ask.
So, I have received the letter, and I came to know that John has some difficulty in walking since 4 to 5 days.
Yes, doctor.
It would be better if you can tell me on your own word about his problem, how exactly it started, and how is it progressing.
Yes, doctor. John was quite normal 1 week before. Initially, he started with this fever, and after 2 days of this fever, he has a difficulty in walking, and there also he's complaining of the pain, and he can't even unable to bear the weight. He can't bear the weight. He
I
can't
see.
walk. Yeah.
I see. So, this pain is only on one leg or both the legs?
No, doctor. It is only on this one leg, on the right side.
And where is the location of the pain in the right side? Is it on the hip area or in the ankle or in knee joint?
It seems once he complains or once when he tries to walk, once he starts walk, then he complains in this hip joint.
Hip joint. Okay.
Yes.
And if he doesn't walk, the pain is not there. Is there pain during the rest also?
Then there is a mild, but it is more severe once he this tries to start walking, and then he literally cries. Then there is a more pain.
Okay. And is there any swelling on that leg?
Yes, doctor. Swelling is also there. Is the red area like there. Swelling is there.
Is
And
it swelling on the hip area or in the any other part of the right leg?
no, that is only confined to this hip area. Only one joint. Mhm.
Okay. Is there any rash on that area? Could you describe in if the rash in the more detail? What kind of the redness is there?
Oh, there is no any rash. It is just this like this redness, swelling, and there is no any specific rash.
Is there rash any other part of the body, hand, face, tummy?
No, doctor. No rash
Okay.
any. Mhm.
And how severe is the pain? If 1 being the least, 10 being the highest, how would you grade your pain?
Yes, doctor, it is 7 to 8 score, like that we can grade 7 to 8.
Okay. Is there anything which makes him feel better in pain?
No, doctor, in fact, once they started the pain, then we John, then we went to the GP. Then he just gave simply some painkiller. So he feels relief for a while, and after some time again he develops pain.
Okay.
Mhm.
And which medicine GP gave?
Simply he gave the paracetamol.
Okay. And he had a fever also. So um, was there only fever, or along with fever there was any cough and cold?
Mild flu-like symptom were there, mild.
Okay.
Yes,
And
mild.
apart from this, any pain in any other joint in the body? Is he complaining of the pain in left leg or hand?
No, doctor. Mild ones, as I told you during walking, he told also sometimes he feel in this ankle in the right side, but no other, the same side only. This that is a mild, but more as told severe only in this right, and no any joint involved of the body.
Okay. And how high the fever did you notice? And how frequently you are giving? Are you giving paracetamol for the fever?
Fever 6 to 8 hourly we are giving this fever medicine, and fever it almost remains continuous. Daily fever, this spikes comes, and only with this and temporary the fever is subsided, and again as once this effects goes down, then again it develops the fever.
Okay.
Yes.
Any difficulty in vision?
No, doctor, there's no
Any changes in the hair loss?
no, doctor, I have not noticed.
Difficulty in hearing? Okay. And apart from this, you feel like this problem is increasing or getting better, or at the same level in this past 4 to 5 days?
No, doctor, it is increasing. As I told you, it is increasing. Initially,
And
it started, yes, 4 to 5 grade we can, it was the mild to moderate. Now he's having severe pain, complaining, and even he can't even touch the hand, and he can't put the weight on the floor, he can't walk. So his pain is increased.
did the GP did any test?
He just do this baseline test, and he just told maybe the mild viral infections, and so he just told better this the child is too young, so better to see by the pediatrician. So he just referred to your good self.
Okay.
Hmm.
Okay. Any difficulty in pee?
No, doctor. So he's
Any
passing.
difficulty in poo?
Yes.
Did he any difficulty in poo? Any loose stool?
No. So he's passing
Okay.
normal.
How about his appetite, eating well?
So he was appetite was he was eating well, but just after this illness, now is decreased to some extent in the last couple of days.
Okay. And okay. Apart from this, was he having the same kind of the problem in the past before?
No, doctor, I don't remember as such. There was no any significant.
Okay. Any hospitalization for any problem before?
No, he has
Any
never been.
surgery
No,
in the past?
no, doctor.
Okay. Did he receive all jabs?
Yes, he has received all.
Okay. Any allergy to any medicine?
Then there's no any allergy.
Okay. Do you have any financial support?
No, doctor, we are coping. We are well off. We are managing on our own.
Okay. How is the others? Does John has other sibling?
He is the only sibling.
Okay. And how about any? Are you putting him in a daycare center?
No, no, doctor. We are
Okay.
not
So
putting in.
at the moment,
But-
he's not going school, right? Any daycare center or day school or?
No, doctor.
Okay.
He is not going.
Okay.
Yes.
Okay. How are you coping with this situation?
Doctor, as I told, this child is
9 minutes.
really in the pain, severe pain, and he unable to bear the weight, and so we are quite worried. That is only our concern. No? The rest of the thing, as I told, finance and everything, we are managing anyhow. But this is really a worrisome for us.
And yeah, I understand. Yes, it is difficult time for you. And how John is coping with this situation, with this condition? I mean, his day-to-day activity and playing and his regular activity at home. How
Yes,
is he
doctor.
coping?
John is a bit miserable, and also as he's having this pain and difficulty in walking, so he can't able to take part in the playing. So
Okay.
yes.
And does he have any distension in his tummy?
No, there is no any tummy distension. Okay.
How is the father's health and your health? Both are okay.
Yes, doctor. We all are doing well.
Anybody in the family has similar illness?
No, not significant.
Any major concern in the family? Any condition?
You mean the same? You are asking for the same condition or any?
Similar condition or any major condition like arthritis or any?
Grandfather. Yes, the John's grandfather has some this joint problem, and that was, I think, age-related arthritis.
Okay.
Yes.
Okay. Has he lost any weight recently? This John's weight is in normal centile. Have you plotted this when you visit to the child doctor?
No, not significantly, but mild, because since it is only 1 week history, so it has not been slightly it is decreased, because since also his oral intake is poor, so only it is decreased to some extent.
And any trauma, any fall down in recently?
No history of trauma. There no history of any fall, nothing.
Okay.
Hmm.
What is most worrying you, Mr. Albert?
Yes, the man, as told, child, this John, he can't able to walk, and moreover he can't participate in day-to-day activities, and he's having this fever spike, and so also for that also he can't, his oral intake is not this adequate, and so we are worried for that.
Right. Is he having any in the ulcer in the mouth or any recently any sore in the tongue?
No, doctor, that is okay. Mouth hygiene is okay. There's no ulcer, nothing.
Mr. Albert, anything you like to tell me which I didn't ask you and you are concerned for?
No, doctor, almost you have all addressed my this concern, and you have asked all the relevant questions.
14 minutes done.
Hmm.
Okay, fine. So I would like to summarize I took a history of a John who is a 4-year-old child and has presented with a complaint of limping, difficulty in walking since past 4 to 5 days. He started to have a mild flu-like symptoms along with a fever since past 4 to 5 days. The pain and little swelling is more over the right hip, and he doesn't have any skin rash or any swelling or any pain in any other joint apart from the right hip joint. Doesn't have any difficulty in vision or any uh, problem in pee or in any bladder movement and any bowel movement, but his appetite has been reduced since past few days. There's no any family background or any past history of similar illness or any change in the weight loss. He doesn't have any allergy. He received all immunization. But father is most worried about his pain because it is affecting his day-to-day activity and playing of John.
Okay.
So, given with the given details and the history, I would like to consider several possibilities. He could have reactive arthritis as on the top of the differential. Also, there is a possibility of a septic arthritis also.
Mhm.
Could be there. The other condition which could present like along with the flu and the fever, the Perthes disease, but age is not consistent with this. Generally after 5 years it is seen. So
Okay.
I would like to consider here to do full musculoskeletal examination. I would like to check the gait, and after that I would like to do some basic tests like complete blood count and looking for any evidence of the infection. I'd also like to consider the X-ray of the hip joint to see any changes. And meanwhile, also I would like to involve my consultant before I take decision whether to discharge this child or any further workup is required.
What is your most probable diagnosis?
Looks like reactive arthritis post-flu.
Do you think this reactive arthritis, with this child having this having this fever, and this child is miserable, and child is difficult and difficulty in walking, and
And second is the septic arthritis, and third is osteomyelitis. These three are the most likely differential.
okay, suppose if how would you differentiate between septic arthritis and osteomyelitis?
Osteomyelitis, the pain is less, the movement is still possible, the range of motion is not that much affected in osteomyelitis, but in septic arthritis, it is severely restriction of the range of motion, and child looks more sick comparison to osteomyelitis.
Okay, well, if it is septic arthritis, then how would you treat the child?
If it is a septic arthritis,
How would you definite the diagnosis?
sorry, how would?
How would you arrive at for the definite diagnosis? Which investigation you will carry out for labeling the septic arthritis?
Septic arthritis,
Definite diagnosis.
yeah, definitive diagnosis is by collaborative evidence of like together with the blood culture, positive, elevated inflammatory markers, and sometimes like the joint fluid aspiration and if the evidence of elevated WBC in the elevated leukocyte in the joint fluid analysis.
Yeah. And how would you help out the child? How would you treat?
Yes, needs NSAID support as well as along with the antibiotic, which covers the gram-positive and H flu, Staph aureus as well as H influenza. Needs antibiotic minimum 4 to 6 weeks, and preferably initial 1 to 2 weeks IV, after 1 week IV followed by oral antibiotic if child shows improvement and response.
What complication would you anticipate in septic arthritis?
If the child does not respond to the antibiotic, then there can be damage to the cartilage, and it can worsen. It can turn into the further osteomyelitis, and it can further turn into the the long duration of paresis or immobility because of unresolved septic arthritis.
Okay, well done, Dr. Hiran. I think already time is exceeded. Extra question I asked. So you did well. So I don't pitfall in the history, except I think in this, while summarizing, we should be more precise. I think so. And as far the you told investigation, I think first you told as the differential diagnosis, reactive as we just elaborated. So it is more of keeping in view these symptoms. So it is more likely the septic arthritis. This definite diagnosis is this aspiration. So we will send for the culture, and sometime we ultrasound guided this aspiration we will send, and also this blood culture supported by also the blood culture. And before commencing the antibiotic therapy, it is written in the guideline that we should first, if there is any high grade fever and there is a restriction of these movements limitation, then we should first before starting antibiotic we should aspirate. So accordingly we should go for the antibiotic. After that we start the antibiotic. And non-steroidal anti-inflammatory as you told, and after once this acute phase is over, then we will also take the help from the physiotherapy. And if the child is doing well, then well and good. Otherwise we have to sometime to take the input also from the orthopedic doctor. And as far complication you told, septic arthritis, sometime maybe surrounding joint may be involved. So osteomyelitis, joint destruction. So these are the few complications. So overall you did well. You are master in history. And moreover it was extended. Yes.
But in fact, regarding this management, no, you asked complication. I was not quite sure. Even the definitive diagnosis, I was not very much sure about this. Usually in real practice, joint aspiration, I think, I don't know, but like invasive, we have to avoid. That's what they are saying. Like you have to give us
right.
clinical diagnosis.
You are right, but child is too young, and this is having this sepsis and everything. As in case of osteomyelitis, as bone scan, MRI, having this high yield. But as for septic arthritis, no doubt it is invasive. Again, if we weigh this benefit and risk, then we have to carry out this aspiration. You go through this, what I have studied. So it is better to aspiration, blood culture. These are mandatory. And anyhow, as far the clinical acumen is concerned, no? So anyhow, somehow you, once I cross questioned you, then I asked you whether it is reactive or septic. So anyhow, you, this is just like also Viva question will be, examiner will ask like that, no? So we have So ultimately you did well, and so I don't think so any deficiency,
You asked
complications.
one question, how will you differentiate between septic arthritis and osteomyelitis?
Yes, that is the yes. Again, Dr. Sandeep Keen observer. The septic arthritis. In fact, this arthritis and osteomyelitis means this metaphysis or this long bone osteomyelitis. They are involved. While as in case of this arthritis, there is a joint space is involved. There is a surrounding erythema. There may be tenderness, temperature sign of this sepsis, septic arthritis inflammation like that. And yes, sometimes this is septic arthritis, it is secondary, maybe this osteomyelitis, but anyhow they are as separate entities. So osteomyelitis need to differentiate it, as it is purely, it is involved metaphysis, and the septic arthritis, it is joint space. And especially if you go for the x-ray, in the x-ray you will see there will be a widening of this spaces in the x-ray in case of this septic arthritis. And in case of osteomyelitis, in early phase, we don't see any finding, and you may got this, the X-ray may be normal. So again, this bone scan, that will pick, or MRI will reveal the diagnosis. Dr. Sandeep, am I right?
I thought you were asking clinical differentiation.
Yes. So how would you?
No.
tell us?
I was thinking that you were asking clinical differentiation. I was
I
not.
think, yeah,
No,
sorry.
I think in osteomyelitis, clinically child will not be so septic, no?
Yeah.
As the septic arthritis miserable, this limitation, vomiting, everything. So in
Right.
that, it will not be that much sick. I think that doctor, I think he told
You
doctor.
didn't answer that.
Yes.
Hello.
Yes, Dr. Eba. Yes.
Yeah, I think the systemic manifestation of both is the sepsis. Okay, so miserable or fever. I think the difference between them is the range of motion in the joint affected. In septic arthritis, there is restricted range of motion, no range of motion. That's severely affected in septic arthritis. But I think in osteomyelitis, the motion could be decreased, but it's not restricted at all. I think this is the main difference. But
Yes,
the
that
systemic
is actually.
manifestations like fever and the toxicity, it's in the same in septic arthritis or osteomyelitis. That's what I think. But the range of motion, I think this is the main difference between them.
Yes.
Yes, limitation of movement, it is written in also guideline less than 75% like that. So this.
See, I will tell you this very simple. I mean, the things which I have observed in real life. Septic arthritis is a very severely restricted range of motion. That's Dr. Jayaprakash said very correctly. Osteomyelitis child, recent past, I had given treatment for two children. They were like absolutely walking, running, no pain. Okay. And in MRI, it was clear-cut osteolytic lesion. I was giving a treatment because of the MRI lesion was there. Otherwise, there is from the outside there is nothing. But septic arthritis, 100% there will be swelling, there will be redness, there will be restriction on movement, pain, fever, many things. Just to help, like this is a clear-cut difference between osteomyelitis and septic arthritis.
Yeah, and I think septic arthritis, it's an emergency. So
Yes,
you have to involve the orthopedic, and the
yes,
orthopedic was the one come and they do ultrasound and the guided aspiration, and according to the culture and sensitivity, you will give a proper antibiotic.
right.
Osteomyelitis and this septic arthritis are almost similar clinically from outside also. Definitely there will be more swelling, but very difficult to differentiate between both of them. So MRI and this bone scan, these are the two best modalities to differentiate among osteomyelitis and this septic arthritis. Secondly, you do aspiration as early as possible before giving antibiotic, and we need to start antibiotic as early as possible, but after taking the fluid, USG guided fluid, to send for the microscopy and culture. So that is how
Yes.
we, yeah.
Dr. Pankaj, here my question, if
Hmm.
you say what I understand,
Hmm.
what you are thinking, straight away we will go for this MRI and bone scan this to differentiate.
First, you have to do inflammatory markers, CBC and inflammatory markers. When there is a swelling and you see clinically there is a fluid, you must go for the aspiration immediately. MRI later on, means second step. But first, you do USG guided aspiration because you have to start the antibiotic. So once you do this, and then you have to go. You should go for the MRI to differentiate whether it is osteomyelitis or septic arthritis. And septic arthritis, there will be means CRB symptom much more than osteomyelitis.
Dr. Pankaj, right? I think once after this aspiration done, and if it proved, and I don't think so, even then after even it will require the MRI and this bone scan.
How will you
If-
differentiate without MRI septic arthritis, osteomyelitis? How will you differentiate?
As we discussed, no, this clinically child will be this toxic, miserable, limited range of these movements, and ultrasound guided we will send, and so I don't think so. It will require the.
I had similar patient 2 years back under my care, and it was I had enrolled pediatric orthopedic here, and we could not differentiate osteomyelitis and septic arthritis